All right, so another one of my Tuesday recaps where I get to go around to our different locations and spend some time with the different PTs that we have on staff, ranging from new grads to people who have been practicing for over a decade. This week, both of my times spent more with our new grad PTs, and it was pretty cool. The first person I got to interact with was somebody who just hit the 6-month mark of their PT career. And we actually spent more time just talking about kind of the evolution of what your first year as a PT looks like, and just kind of connecting some dots for him, reaffirming that he is doing some things the right way, providing him some strategies to help handle a little bit of the unknown that you consistently encounter, especially during your first year as a PT, but you're inevitably going to continue to encounter it throughout your career as well. But just some highlights of our talk was really breaking down his first 6 months into months 1 through 3 and months 3 through 6, and then what to kind of look forward to for the remainder of this first year in 6 through 12 months. And we kind of came to the agreement that the first 3 months, you're just trying to get your feet underneath of you and figure out what the heck you're doing from a day-to-day standpoint, a week-to-week standpoint. What is it like actually having a career, having a full-time job that you are going into? And you get a little bit of a taste of that as a student, meaning that you get the sample of treating patients, going in for a 40-hour work week, but you always have that safety net of your clinical instructor being there. So really the first 3 months is just having that autonomy and the ownership of carrying an independent schedule, and really working through all of the challenges of being the sole person who's making the decision and the plan of care, not having that safety net there of somebody to bail you out, and really just kind of, taking your lumps as they come during those first 3 months as you try to put your best clinical decision-making skills into practice of what you've learned in PT school, what a textbook says you should do from an evaluation and from an intervention standpoint, but then getting hit with kind of that real world reality of how does this play out? How does this patient actually respond when we do a test with them? How do they actually respond when we give them exercises? Are we overwhelming them? Are we underwhelming them? Are they having that linear path that we envision that they would have? Or is it kind of more of an ebb and flow with their symptom profile and their overall gains from a symptom and a functionality standpoint? So I would say like months 1 through 3, you have a sample size of like n equals 1 for almost everybody that you've seen. And you're really just accumulating data points at these times and continuing to see new and variable diagnoses. And every time you see someone, it's the first time that you've encountered an individual with chronic low back pain, or a post-op rotator cuff, or plantar fasciitis, or whatever that diagnosis may be. So you understand what and how they should respond based off what you've learned in PT school. You've probably encountered some of them as your time as a student with the CI, but now this is your first time in your working career that you're actually handling this injury or this pathology and seeing how that plays out. So in addition to all that in the first 3 months, you're also just figuring out, maybe it's a clinic that you did a clinical rotation at, or maybe it's one that's completely new to you, just trying to figure out where do you fit into the grand scheme of things? What's my role? What's my place within this company? Logistically, how does the flow of my workday go? What is it like doing documentation on my own, doing billing on my own? What does my overall clinical volume look like? And is that gradually ramping up as I'm spending more time and just accumulating more weeks and months in the clinic? And then how does my, quote unquote work-life balance, or what does my time in the clinic and outside of the clinic look like? Am I able to accomplish all my tasks and roles and responsibilities within the clinic, or do I find myself taking them home with me? Outside of the clinic, how am I squeezing in all the other stuff that I want to do from either just daily living standpoint, commuting, planning out meals, or more of a leisure standpoint? Am I finding ways to carve out time for yourself? Are you finding ways to hang out with your spouse or your friends or whoever you want to interact with? And I really think it takes a good 3 months just to try to get a good handle on what that flow looks like. In months 4 through 6, this is where you start to see some of your cases reach closure and have a sense of finality with them. So now you're starting to get to the point where you've been practicing for 3 months, you've had 3 months worth of evaluations leading up to this, and you're starting to see that full plan of care play out for individuals. Now, when I say full plan of care, that can go a variety of different ways. Sometimes that's actually having an evaluation, developing a plan of care with an individual, and then seeing them on a consistent basis throughout 3 weeks, 4 weeks, 6 weeks, 8 weeks, whatever the duration is, having a formal discharge, having them meet all their goals, and giving them long-term strategies for success. Sometimes this full plan of care is the realization that the person we evaluated 3 months ago, they fell through the cracks and they never made it back onto our schedule. And we're just realizing this now as we're going back through our schedule and we're trying to find who those missed patients or lost patients are. Maybe you're coordinating with the front desk to reach out to them to figure out what happened or why they didn't return. Maybe you're also getting hit with the reality of your perfect plan of care just didn't match up with what the patient wanted or what they were feasibly or logistically able to do. So maybe you wanted to see them with a certain frequency and duration, but they just weren't able to make that work for their schedule. Or maybe they did not see the value of PT to make time for that on their schedule. So I think months 3 through 6 act as a huge learning experience where you're starting to not only get inundated with that influx of evals that you have during your first 3 months, but you're seeing people throughout the entire continuum of care. You're seeing how their injury and their pathology plays out just from a biological healing standpoint, from your ability to intervene and make changes with them, but also the human element. And what are all these other things that can influence a plan of care that they're touched on in school, but you don't really get a full grasp for how much they can influence a plan of care until you're face to face with the patient trying to triage these situations. So I always say the first 3 months is just working out the logistics of having a career, being a PT and being on your own. Months 4 through 6 is where you really get to start to dive into a little bit of the X's and O's of what's working, what's not working the way that I thought it would, and what are all these other complicating factors that are just making the plan of care that much more challenging to carry out. And then months 6 through 12, that's where you start to tinker a little bit. And that's where you start to get evaluations of injuries and pathologies of things that you've already seen before. And you can start looking back to what used to be a sample size of n equals 1 and pull some of those previous data points that you've had and use those to your advantage. All right, when somebody came in 4 months ago for this and they fit a similar symptom profile, mechanism of injury, age, demographic, sport or activity, what worked for that person? Or what communication style did I utilize that that person responded very well to? And how can I use that to leverage this current situation? So the first year of a PT, it just takes time to get enough repetition and exposure to all of the different things that can influence a plan of care, and really just your ability to have a fun and fulfilling career and figuring out what you value, what you prioritize, what's important for you. And it's a consistent and continual learning experience. So it's one of my favorite parts of the job is just being alongside these PTs and honestly just acting as a sounding board for them. And I would say it's less about me teaching them and coaching them about what to do and what not to do, but just being a sounding board for them to speak out loud, hear them voice their own thoughts, and then come to their own conclusions from there.